Hello, everyone. We are having a COVID-19 convo today on getting censored and kind of what we see on social media as it relates to COVID-19 vaccines. I'm going to wait for my co-host to join, and we will get started in a moment. We'll be getting started in just a second, everyone. Thanks so much for joining us today. All right, cool. So in a second, I'll be joined by my wonderful colleague, and we're going to talk a little bit about COVID vaccines and just what we've been experiencing as folks who are navigating the pandemic and what we're seeing on social media. Are you able to join? All right. Hello, hello.
Hi, girl. Hey.
How are you doing?
Good. Can you hear me?
I can hear you.
Ugh,
Can you hear me okay?
I can hear you okay. And I also have my, what is it called? I have my, I forgot my influencer stand.
Oh, man. So we're looking at this, but you still look beautiful. So
Thank you.
you're giving us here on Instagram Live.
I'm giving. It's an afro. Do you remember that girl? The little girl?
Yeah. The cutest on social media.
I like your hair. It's an afro.
Thank you.
Thank you.
Well, cool, everyone. Welcome to our COVID-19 convo. Today we're talking about getting censored and reasons why people might be getting censored, what we're seeing on social media that leads to a lot of back and forth and commentary and censorship. But we'll start off by introducing ourselves. My name is Jewel. I work in the External Affairs Department as Director of Communications, and my pronouns are she, her, hers.
Hi, my name is Rama. I work in the Community Health Department, and my pronouns are she, her, and hers. And as Jewel mentioned, we're back on our COVID combos. It's a regular, thing that we do here on Whitman-Walker's platform. Just, for the conversation, the education, to kind of talk through some myths and facts and just kind of tell you all the latest that's out there, from a perspective of, public health workers. Really put the information, make sure that the information is simply put, for all of us to understand what's happening. So today we're going to kind of talk about social media censorship and COVID-19 misinformation, like what that looks like, why people are being censored, how people feel about that, especially, our mega stars. But to start, as you know, we've been utilizing this platform quite frequently to expand upon our social media outreach efforts. We talk about various health topics, from HIV to STI, sexual health practices, access to care, social determinants of health, Our series has been heavily focused on the current pandemic, COVID-19. You know, although there's a vaccine out there now, a plethora of folks have gotten vaccinated and are doing better, but unfortunately not enough folks. So the pandemic is still going, people are still dying. So this conversation is still extremely important. You know, ways to manage your sexual, personal, and mental health, and let you know that Whitman-Walker, as care providers, we're here for you. You know, excuse the ambulance. We're here for you. And yeah, so usual, we're going to get down to the facts here and the experiences with the vaccine that we've personally had, what we've heard. So we're going to talk a little bit more about censorship and how people are experiencing it, what people are doing, what misinformation looks like on social media. You know, huge platforms are saying, nope, you cannot say that. So we are going to ban that. We're going to censor you. We're going to let people know that this is not true. More specifically, we're going to get into Nicki Minaj. On my personal social media account, I posted it. I was like, you know, let's talk more, because I have folks who are not vaccinated, folks who are vaccinated, pro-vaccine, and folks who have declined the vaccine. So there are a lot of back and forth that happens. Provide space for both folks, just to kind of get a better understanding of what's going on and their perspective. Although I'm 100% on the get vaccinated side. I just want to know what's going on. So yeah, so a lot of people just like the Nicki Minaj last week. It took over the internet. What a disappointment. I'm just gonna put that standard out there for myself. You know. So yeah, we'll give you the latest. Where you can get vaccinated if you're interested. Of course, Whitman-Walker, you can always come to us. You know, get that appointment to get vaccinated, to learn more. Call that number. So yeah, Jewel. You know, let's tell them, like, why did Twitter or the internet at large censor Nicki Minaj?
Well, let's go back and see what Nicki said that led to censorship. So recently, Nicki Minaj tweeted that she is not yet vaccinated because she is still doing her research on the COVID-19 vaccine, because her cousin's her cousin's friend in Trinidad, who she claimed received the vaccine, became impotent from receiving the vaccine. And she reports that his testicles became swollen. His friend was weeks away from getting married, and now the girl called off the wedding. So just that people should pray on it and make sure that they're comfortable with their decision about being vaccinated or not being vaccinated, and not being bullied into being vaccinated. So I feel like there's a lot to unpack there, from you know, COVID vaccine claims to impotency to testicles being swollen. But, you know, we work in the sexual health space. So did anything kind of ring a bell in your ear when you heard that this person had swollen testicles?
Yeah, gonorrhea, an STI of some sort. And again, I'm not generalizing, you know, but I definitely would not say COVID-19, you know, was the cause. There isn't data on, quite frankly. And especially the way the story was shared, in the sense of this cousin was getting married, right? And then their partner canceled the wedding after the person being impotent, like, you know. And I think to myself, I'm like, oh, well, if my partner was sick, we're about to get married, COVID-19 caused this, I think I would support my partner, right?
Yeah.
Not off the way. But if my partner contracted an STI before our, you know, wedding day,
Yeah. I might be calling off the wedding then.
we might need to talk about some things. You know, maybe this level of commitment you're not ready for. Let's do some negotiation. Let's figure out where we are in this relationship and kind of assess, you know, what works for one another. So it was just, overall, it was just irresponsible. Like, I think the internet, especially with this new age and this new era, that's why we're even on here doing live. Like, growing up, when I was in high school, I'm not that old. When I was in high school, was like what MySpace, and you really even college, even undergrad, even like it just really the access to the internet. The internet was not where I received credible information. I did not base like life changing or important decisions based on the internet. It was a good time, you go there, but now this is where people get their information. So it's so important to be responsible in that space, responsible, to say like what you are, to be mindful of what you're sharing, especially to our new millennial people, like the younger folks, the social media era. So it's really important. I thought it was extremely irresponsible, whether you have one follower or you have 22 million followers. It's really important to ensure that you're using your platform in a way that isn't harmful. Yes, it's yours, say your piece, but be mindful, like actual facts. Like Nicki Minaj is a rapper. I'm not going to debate Nicki Minaj on anything dealing with rap. That's not my area of expertise.
Or itty pickies, like we won't get into it with Nicki Minaj. We know that she's.
I'm not doing that with you. You're also not my point person for vaccines. When did we start this level of research that's essentially detrimental, which we know the public health officials in Trinidad came in contact, like did a public statement, researched this said cousin, to kind of really check the facts and share with the community. And it's just being a Black person, a foreigner, where access is so limited to vaccines, something that can save us and protect us. It was extremely irresponsible, in my opinion, to use your platform to do such, because it's to deter our people who are dying, at the fastest rates and the highest rates, and our Caucasian counterparts. So I just, I just shook my head, and as I was just like, wow, people just do anything. And the worst part about it is she did not say that she wouldn't get the vaccine, right? But simply the attachment of the cousin's story or his impotence or, all of that, people lost the fact that in the midst of it, she said that when she knows that she has to go back to work, she has to believe in the vaccine in some sense if she's already thinking about getting the vaccine. It's just in this instance, she hasn't yet. But now there's been like a ban on the vaccine, and she's, not taking responsibility for the misinformation that was put out there, even though there was research done, with the family members to know that that was not the case with this man. And due to, obviously not to violate, the person's HIPAA rights, we don't know all the details of why that happened, but it definitely wasn't the vaccine. Like now, Dr. Fauci's new job is talking to celebrities about the misinformation they're putting out there. Yes, censor them. It's unacceptable.
Yeah. All of that. Please visit cdc.gov if you'd like, factual research in a lab, data and information about the vaccines. We all scroll on social media and can find information on it, but if you want a really credible source, you don't have to go and like dig another 2, 3, 4 layers on the interwebs. It's important that you visit websites like cdc.gov to get your vaccine information and to research statements like testicles became swollen and vaccines versus, figuring out what the actual cause of that is. You mentioned censorship just now. I feel like, a lot of folks right now are being censored. They are, I'm assuming that they feel like their First Amendment rights are being violated because of the censorship. I think that I might feel that way too in some instances. But I'm also a person who will go in and watch some of these videos and commentary on these accounts because I want to see, what's causing these accounts to get censored. And so I think a lot of the time what I find is that folks are still not fully understanding how vaccines work, and they end up sharing misinformation or incorrect information about how vaccines work. And then they'll also have really great information about, the benefits of certain natural foods and natural herbs and what they can do for your body and your health and your immune system if you make them part of your diet. But that coupled with wrong information about how vaccines work, I understand why the video is being censored. So just a quick primer. Remember, everyone, vaccines and like the COVID-19 vaccine is not meant to keep you negative of COVID, it is meant to keep you healthier if you were to get COVID. So it's almost like you gave yourself a little bit of a shield. If you were going out to battle, you gave yourself a little bit of a shield by getting your vaccine. Without getting your vaccine, it's like you're going into battle and you didn't put your shield on first. So it's just one offers you more protection, one prepares you for the battle, one will keep you healthier if you did have to go into battle. But it will not keep you free of COVID-19. Only taking all preventative measures of getting vaccinated and wearing your mask when in close and tight spaces and not being indoors in tight spaces without a mask on is going to help you kind of stay negative and free of COVID-19. And to that extent, that same video, I believe, commented on people getting third doses and booster shots, and that's after the first one didn't work, but the first shot worked. Like it kept that person healthy and alive, and not in the hospital or intubated, in like a COVID wing. So I hope that folks who might see this video and who are experiencing censorship are just cognizant of the reasons why they are actually being censored. No one is, talking crap about your sharing healthy foods and natural herbs and stuff. We love that. But coupled with vaccines.
We love to see it. A combination of a holistic approach and a Western medicine. Like, I understand that there are a lot of, again, we've mentioned this so many times on the platform, there are a lot of diseases, viruses that we no longer get because of vaccines.
Mm-hmm.
It doesn't change. I don't think a lot of folks don't understand how the mRNA vaccine works and, what resources being allocated. This was like the one thing that globally, everyone was focused on developing a vaccine for this, considering the damage and the effects that it's done, the lives that we've lost. In America alone, over 700,000 people have died due to COVID, and we are still dying. So it's really important to ensure that you are being responsible with the messaging that you're putting out there, or give people that some people are, like I said, some people live on social media. So being censored it's actually helpful to those folks who get their news on there, and a lot of people do.
Mm-hmm.
And just encouraging folks to go to credible resources like CDC. We can all argue about the healthcare system itself, but the science has worked. And in comparison to the way folks were dying at the beginning of the pandemic prior to the vaccines, there's a huge difference. 99% of people who are currently hospitalized and receiving ventilators and dying are folks who are unvaccinated. Breakthrough infections are happening. Those are for folks who are vaccinated, but it comes out like a common cold. They are not hospitalized. Folks who otherwise would have been hospitalized and probably facing tougher conditions, and in ICU if they were not vaccinated. So it's just important to remember that. And when folks say, oh, it's your choice, or it's my choice to do this, to do that, sure, it is. It's absolutely your choice, but you also cannot spread misinformation, or else you will be censored, which you should be. That is the bottom line. And this whole research, like, it's very confusing to me. Like, I mean, as much research as you need to do, but why are you researching what isn't true? Something that aligns, with your hesitancy or your decline of the vaccine. And it's not even like a credible source. At least, like, it's like, I can take my time with it. I'm going to keep seeing, but what the data has shown, like in black and white, it's very evident that being unvaccinated, the risk is higher, and like the risk of it's fatal, essentially. So it's just more so, doing your best to trust the science, and at least being honest with the people who follow you and your platform, and if the larger your platform is, the more mindful you need to be about what you share. Like I said, even if you have one follower, it's still it's harmful. Should not
follower.
Misinformation is damaging, rather than stay home and wearing your masks and focusing on that, taking your own precautions because you are not ready to get the vaccine, let's not add to the misinformation that's already spewing the nets. And I am all for censorship in that sense. Absolutely. 800% support it. Support people getting kicked off of Twitter, getting kicked off of Instagram, being censored, and all of that. And we could stand to censor more things, but that'll be another topic.
COVID-19 vaccine misinformation.
Yes, yes, definitely.
You know, one of my favorite memes that have been circulating the interwebs during COVID, especially in this kind of phase of like, I'm doing my research. I'm doing my research. It's that photo of of like one person who's doing their COVID-19 vaccine research, and they're just scrolling on their phone, and they're like in the bathroom on the toilet, and you know they're getting all of their information by scrolling right now. And then it's next to a photo of an actual scientist who's in a lab who's been researching, you know, mRNA vaccines for years and years and years. You know, microscope and all, petri dishes, all the things.
All the
But let's compare the two, and you know, one is clearly like outweighing the other right now in terms of how people are viewing vaccines. So I just find that one hilarious.
same. I
For
think
do their research, but like do it on CDC.gov where they have the facts from the person who was in the lab, you know, with the microscope, with the petri dish, doing the actual research.
exactly. And then my favorite one thus far has been your science teacher was handing back your test face down, but you want to do your own research on the vaccine. Like, let's talk about it. Like, your chem teacher was like, oh, all your tests. So research should have been done. You know, let's just leave it to them. Just like Evan, I'm not an IT person, so that is not my area of expertise. So let the expert do what they do, you know, and make sure that you are wearing your mask, you know the resources are to you, and have a conversation with your provider. Like, why are we skipping that part, you know? Or a provider. Like, check the number down there. You can call us. We'll have the conversation with you, what your decline looks like why you don't want to get the vaccine. We'll talk through it, you know, just to get more information for yourself. You know, I think that is the kind of research, like when folks say research, yes, but when it comes to reading data of, that's, especially if that's not your line of work, how can you even put that into, because you think word of mouth is what the research is at this point, or you know, or your own personal like hesitancy has led to this research, or a space of like folks, you know, folks providing information, what is it, on YouTube, like the conspiracy theorists, like or there's a chip in the vaccine. If you have a cellular device, that's tracking you way more than the vaccine could ever track you.
Yeah.
Yeah, just let it go, you know? But yeah, so it's really important to have these conversations, especially with folks that you trust in your community. Make sure you're talking through it and going places that are actually credible. So,
CDC.gov. I know that they told us to not wear masks very early on in the pandemic, but they learned that we needed to wear them, and then they told us that we needed to wear them. So just know that we're going to keep learning new things, and they're going to keep having to give us the latest information and possibly backtrack on some old information. But it's not out of them being wrong or them lying to you. It's about them learning as we go. Because this whole COVID-19 thing is new, you know, 2 years old, new at this point, but like new. Well,
someone, I think Goldstein, Bianca, have you ladies got information about some people getting the second dose and getting a false TB reading?
we'll have. Oh,
Indeed. No, I can't say.
yeah, I think we'll need to follow up on that for.
Yeah, we'll definitely follow them, but Bianca can get back to you.
Um, yeah, well, I know that I thought it was really important for me to get my vaccine because I wanted to protect, you know, myself and my loved ones, and I couldn't, you know, tell people that they need to get vaccinated without having a vaccine myself. How come you got vaccinated, Rama?
No, I think living with a chronic illness, it was important to protect myself and my community, you know, because again, Even like when it comes to the boosters, the third dose and all that, it's really important to remember that because people are not getting vaccinated, that's why boosters are, like it's talked about it was a thing, but it was absolutely going to be a thing as we have different variants developing and people are not getting vaccinated. So
And
the,
the less
the
vaccinated, more variants that we are going to experience. So
so
you
we
thought
don't
the first part of the alphabet was funny so far, get ready for the rest of it.
we don't want this virus to mutate anymore, so get vaccinated or stop spreading misinformation. And
And call us for more information at 202-207-2480. Or if you felt moved to get a vaccine appointment by this conversation, you can also call that number and schedule your appointment. Um,
yeah,
you
so,
can also, email us at appointments@whitman-walker.org to schedule your appointment. We can register you at our different outreach events in the community, all the things. So call us. Don't hesitate to email us. We just want to answer your questions, help alleviate any concerns that you might have about the vaccine, and keep you healthy and thriving. But most importantly, if you're not getting vaccinated, it's super important that you especially continue to follow CDC guidelines for mask wearing and quarantining and social distancing and the like. And please do consider getting your vaccine. Discuss your COVID precautionary measures with people who are around you and who you share space with, or who you might be going to visit or see if you're traveling. But just be mindful of keeping your mask on over your nose and mouth and keeping your distance, especially when you do not know if a person around you has been vaccinated or not.
yes.
Yeah,
Normalize telling people your exposures, please. Don't put folks at risk. Normalize telling folks that you are not vaccinated. Normalize asking people if they're vaccinated. Okay. It's extremely important, especially as we enter the winter and fall months. So if you are in DC and you're interested in getting vaccinated, coronavirus.dc.gov. If you're in Virginia, vaccinate.virginia.gov. If you're in Maryland, covidlink.maryland.gov. And of course, again, Whitman-Walker, you can call us here. Welcome everyone. The vaccine is free. The conversation that you can have about the vaccine is free. It's at your service. It's at your leisure. Use it. We are a resource to you.
exactly so. And if you are looking for ways to support Whitman-Walker during these pandemic years, we'll probably call them, you can register to walk, run, and donate to our 5th anniversary of the Walk and 5K to End HIV. It's formerly known as AIDS Walk Washington, and it'll be on Saturday, October 23rd. And you can register at walktoendhiv.org.
And yes, you're right, Ghost. Yep, I just got my flu shot today.
And get your flu shots, people. But yeah, all right. Well, thank you all for joining us, and don't hesitate to reach out at appointments@whitman-walker.org or 202-207-2480 to schedule your vaccine appointment or get some questions answered about vaccines.
Yes. Thank you. Bye.
Bye.